Literature Review and Analysis. This presentation is a literature review and analysis completed by myself, Tatiana McGinty, registered nurse. The purpose of this literature review and analysis is to review and synthesize the data and conclusions of current research relevant to the prevention of venous thromboembolism among hospitalized patients. What is venous thromboembolism? Venous thromboembolism is comprised of both deep vein thrombosis and pulmonary embolism. A blood clot forms within the vein and can reduce blood flow to organs and tissues vital to the body's function. Venous thromboembolism is a prominent issue within the healthcare field. Many individuals who are at risk for VTE include hospitalized patients. Hospitalized patients are a greatly affected population due to risk factors such as increased incidence of physical trauma, long periods of immobilization, and other comorbidities related to their hospitalization. VTE also causes a high risk of mortality to hospitalized patients. According to research performed by Nerelden et al. 2024, in a study analyzing extended duration thromboprophylaxis for postoperative patients, VTE was the greatest cause of mortality within 30 days of surgery for cancer patients that received abdominal pelvic surgery. This study also supports the relevance of VTE treatment. Prophylaxis should be used in prevention of VTE, and according to randomized controlled trials referenced in this study, pharmacological treatment results in significant decrease in VTE. The problem that is faced with VTE is that it is globally a leading cause of death, contributing to 1 in 4 total deaths. Al-Mughid and Bayraktar 2023 as cited in Wendelbo and Razgov 2016. VTE continues in prevalence among hospitalized patients despite the available methods of treatment and risk assessment tools. Inconsistencies and poor knowledge of VTE is contributing to poorer patient outcomes. Nursing practice is relevant in discussing VTE because nurses are primary healthcare providers at the bedside. Nurses help to implement interventions to prophylactically treat and prevent VTE. Nurses also have the responsibility of educating patients on VTE and best practices of prevention. Nurses also have the duty to advocate for effective interventions in the plan of care for their patients when necessary. A study performed by Al-Mughid and Bayraktar 2023 evaluated the knowledge and prevention in the practice of 8,628 nurses across 14 studies. This review found that when assessed on knowledge of VTE and its prevention, nurses were scoring low with an average of less than 50% correct answers. This study also found that 5 out of 11 included studies concluded that nurses had unsatisfactory practices in preventing VTE. The search for the literature included in this review was conducted utilizing journals including information for thrombosis as well as cardiovascular disease. Supporting literature in this review and analysis was gathered from similar journals as well as through biomedical libraries. The studies chosen to be reviewed in this presentation features levels 2, 3, and 6 of various study designs for a comprehensive review on the topic of VTE. Sources are current, peer-reviewed primary sources of research that are quantitative in description. Limiting criteria or subheadings that were utilized in finding these sources include venous thromboembolism, knowledge of VTE, and VTE prophylaxis. The study, Universal EHR's Clinical Decision Support for Thromboprophylaxis in Medical Inpatients by Spiropoulos et al. 2023, performed a cluster randomized control trial that involved integrating a clinical decision support tool within health record systems to decrease the incidence of thrombosis in hospitalized patients. In this trial, it was found that 80.1% of patients in intervening hospitals received proper prophylaxis in comparison to 72.5% in control hospitals. The study also gathered that VTE incidence in intervening hospitals occurred 0.6% less after incorporating the CDS tool into the EHR. An additional finding included that the proper prophylaxis after discharge was continued more frequently by intervention group patients by 6.1%. The interpretations of this study conclude that integrating the CDS tool into the EHR systems is an effective method for VTE reduction. The study also determines that mortality is reduced when patients practice appropriate thromboprophylaxis after discharge. It has also been found that in the hospital setting, as well as after discharge, VTE prophylaxis is underutilized despite the data collected. Contraindications within the study include a lower VTE incidence, but an increase in mortality by 2.1% compared to patients who did not receive the CDS tool. This may be due to increased COVID-19 illness within the hospitals that received intervention. This study is a Level 2 quantitative experimental randomized control trial. The study, Low Awareness of Venous Thromboembolism Among Neurosurgical Hospitalized Patients, a cross-sectional study by Lin et al. 2023, surveyed hospitalized neurosurgical patients for their current knowledge on VTE utilizing a questionnaire. The survey results found that the average results of VTE knowledge of these patients scored low at 32.24%. Most frequently, patients that were surveyed did not have adequate knowledge to identify signs, symptoms, or VTE risk factors. 38.9% of patients were unable to identify any VTE symptoms. It was also found within the study that patients with an educational level of a college diploma or higher had more knowledge of VTE. This study is non-experimental, however, it recommends for VTE education by healthcare team members to be incorporated more frequently in patient care. It is also encouraged to improve effective education to utilize different methods for different age or developmental populations. This could include implementing online or social media resources for a younger technology-dependent population. The study also suggests increasing the VTE training of medical staff to result in sufficient patient education. A gap in the study is the lack of research to analyze the reasoning for patients having poor knowledge of VTE and prevention. With more extensive data in this area, tailored and more appropriate approaches to VTE prevention could be implemented. This study is a Level 6 quantitative descriptive cross-sectional study. The study Venous Thromboembolism Prophylaxis in Medical and Surgical Patients, What's Our Reality by Roca et al. 2023 analyzed a group of 128 medical and surgical hospitalized patients over time for the incidence of developing VTE and the effects of anticoagulant drugs. The study found that both medical and surgical patients have a significant risk for VTE. 81.3% of surgical patients analyzed had moderate or high risk of VTE, while 40% of medical patients had high risk of VTE. The study also found that most patients did not receive appropriate VTE prophylaxis. 48% of the individuals within the sample received appropriate VTE prophylaxis according to their risk, while 52% did not. The interpretations from this study include the need for effective prophylaxis. This would include ensuring that interventions are initiated when risk is identified, and that the interventions are appropriate for the patient's risk of VTE. The study also indicates that there is insufficient prophylaxis of VTE being implemented for hospitalized patients. This study argues that there are inconsistencies in the administration of pharmacological VTE prophylaxis. The study states that 30% of sampled patients inappropriately utilized pharmacological prophylaxis, including overuse and underuse regarding risk. This study is a Level 4 quantitative descriptive prospective cohort study. Among all three sources of literature, comprehensive findings state the need for improved education and appropriate prophylaxis. Currently, there is a limitation in knowledge of VTE for patients as well as healthcare workers. This implies that education should be increased to ensure patients are aware of their risk and treatment, and healthcare providers can effectively prevent VTE through appropriate interventions. These three studies all have determined there is opportunity to improve in providing the most appropriate levels and methods of VTE treatment. This could imply the benefit of utilizing risk assessment tools to determine the best methods of care. Studies in this review also found that there is a lack of VTE prophylaxis when necessary. This indicates a need for implementing interventions as soon as risk is determined. In conclusion, nurses are an imperative part in the successful prevention of VTE. Nurses are directly caring for patients at risk. Therefore, it is important that they have a strong foundation of VTE knowledge and implement the various methods of prophylaxis appropriately. This, along with a proper education of patients at risk, will increase the adherence to VTE prevention and improve hospitalized patient outcomes. Some recommendations for further research can include conducting randomized control trials for the findings of non-experimental studies. This could test the hypotheses that the study's implications are effective. It would also be beneficial to gather an understanding of why there is a lack of VTE knowledge. This would allow educational interventions to be implemented early on and prevent poor treatment with a strong knowledge of VTE. Here are references for primary studies reviewed. Here are references for supporting studies.